everybody, Dr. Schaefer here, and we are going to be talking now about Nexplanon Removal. Here we go. I didn't write it ahead of time. There we are. Nexplanon Removal. Okay, so with IUDs, insertion is a little more complicated. Removal is usually easier. It's kind of the reverse with Nexplanon. Placement is really super straightforward. Removal can be a little trickier. So Nexplanon, as you know, is a 3-year contraceptive implant in the upper arm. Now, patients may want to get it removed for a couple of reasons. They may either be sick of it as a device, they may be having side effects they don't like, they may want to get pregnant, or maybe we're removing it and putting a new one in, and you can do that at the same visit. In any case, whatever the reason, we are removing this device in a procedure slot, so you're going to want the patient to sign their consent form before they get ready to do this. And what you're going to want to have in the room are most of the items you can find in the pre-stocked Nexplanon kit box for procedures, but I'm going to go through this just in case. So what you're going to be doing is positioning the patient on the table with the site of their Nexplanon, usually the upper left arm, exposed. So if that means they have to change out of their top into a gown, that's fine. If they're wearing something sleeveless or short sleeve, that's great. You're going to want to have in the room about 3 cc's of a local anesthetic, lidocaine. Other things that you're going to be needing from the box are your iodine swabs for disinfectant. Then you're going to want to have ready for your provider a scalpel. We want the safety scalpel number 11. It's the not a curved blade, it's a pointed blade. And then on top of that, we need a small Kelly or hemostat. And we also need several gauzes for blotting. Okay. So after the patient is positioned, the location of the distal end of the Nexplanon is identified, and the provider is going to inject it with their lidocaine. After that numbs up, they're going to ask for the scalpel. You're going to pass them the scalpel. They're going to make a small incision and try to visualize the end of the Nexplanon. And this is where it's sometimes a little tricky. You can feel it, you can see it, it's hard to get it to come out. Sometimes there's a little capsule around it. So occasionally they just pop right out. That's the easiest thing in the world, but your provider might then ask for the mosquito hemostat. And what we're going to do is use that to try to grab the distal end. So you, as the nurse assisting, may be passing the hemostat and the blade back and forth a bit as the provider works there. Sometimes also I will ask a nurse to actually provide some pressure on the upper arm, so that will hold the position on the end of the rod, and that makes it a little easier for me to grab. Once I can grab that, there's some traction applied, it comes out, that is shown to the patient, then that is garbage. And then your job is to clean that wound up and to bandage it with a pressure dressing to minimize bleeding and bruising. If we're putting a new device in, we just proceed right on to inserting the new device at the same site, same local, super easy. But if we're not doing another device, we're going to bandage it. And again, in the box, you're going to find a few things to do that with. You've got a sterile arm bandage. There's also a bandage roll. There are some steri strips, and there's some antibiotic ointment in here. And usually it heals up super well, but you do want to ask the patient to keep the pressure dressing on for at least 6 to 8 hours, and then they can take it off and use a Band-Aid. So that's usually it. Pretty straightforward, although occasionally it can take a while if that device is being stubborn. And so sometimes you have to reassure the patient a little bit that everything is going fine. Okay, hope that helped. Take care.